Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
A mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Bala Simon. He is the Deputy Chief Medical Officer at the Arkansas Department of Health. Dr. Simon, thanks so much for being here.
Well, thank you for having me today.
So we're talking about stroke. What are the most common risk factors for stroke and how can they be managed or reduced?
That's a great question. And it's a great topic this month because February is the American Heart Month. And stroke is one of the leading causes of death in Arkansas and in the nation. About close to 20% of heart disease deaths are due to stroke. And when you talk about the common risk factors for stroke and the unfortunate nature it causes for the individual who has stroke and the family, the leading risk factors are high blood pressure, high cholesterol, diabetes, family history of stroke, and then the behavioral factors. Heart disease can increase stroke too, particularly those with atrial fibrillation or heart rhythm problem increases the stroke risk. But behavioral factors like smoking, excess smoking, drinking, or any other drug use can increase the risk of stroke as well.
And there are two different types of stroke. What are the differences?
So commonly there are two different types of stroke. One is called the ischemic stroke, which is the most common one. It is due to blockage in the artery which supplies the blood to the brain. That causes ischemic stroke. Blood carries the oxygen to the brain, and oxygen is vital for the cells of the brain, and brain is like an electric circuit that controls the body. So when the blood supply to the brain and hence oxygen decreases, you get an ischemic stroke. About 80 to 85% of all strokes are due to ischemic stroke. The other type is called the hemorrhagic stroke, where the blood vessel to the brain ruptures and there is bleeding within the brain. And that can be very dangerous and people can die right away. So both strokes, these are the two common forms of stroke.
And how do the prevention strategies vary between the two?
Well, while the common risk factors are pretty common for both of them, and so is the prevention strategies are common. We advocate for some behavioral modifications, particularly checking your blood pressure. You know, I tell my patients every day, high blood pressure is a silent killer. So people don't recognize that their blood pressure when it's high unless it is very high enough to have them to have a chest pain or have some facial drooping or unable to feel one side of the body. And then they, lo and behold, find out that they have a very high blood pressure. So that is an important factor. It is important. That's why we need to, patients and people need to see their doctor to check their blood pressure under control. High cholesterol, diabetes, it's very important to keep these under control. Of course, the behavioral factors like not smoking, drinking, or doing any other drugs, and preventative visit to the doctor can take them miles in prevention for stroke.
And what role does stress and mental health play in the risk of stroke? Are there many strategies to manage those factors effectively too?
Absolutely. As I said, this is the American Heart Month, and heart, in a sense, which supplies the blood to the brain, are all connected, and stress and mental health plays a huge role. We have stress hormones like cortisol or epinephrine, which is, cortisol is secreted throughout the day. And also epinephrine, which is the flight hormone or enzyme. So when the body responds to stress and when their blood circulation is pumped, heart pumps faster, there is always an increased risk of bursting out clot or heart rhythm abnormality causing AFib and stroke or rupture of the blood vessel from the heart. So stress is a major factor. And in this day and age, it is with so much going on with the social media, with the online engagement, with the so much noise around. It is important to take time for oneself to de-stress, and there are several strategies one can de-stress and take care of their stress to prevent any strokes or heart attacks in future.
Are there certain age groups or populations that are at higher risk for stroke?
Absolutely. Unfortunately, the risk of stroke doubles every decade after the age of 50 or 60. So, older one gets increased risk of stroke. Of course, the compounding factor is the some of the medical conditions, which happens as a consequence of aging as well. High blood pressure, diabetes, cholesterol. So age is an important factor which increases the risk of stroke.
How can someone recognize the early warnings of stroke, signs of stroke, and why is quick action crucial?
So we use an acronym BFAST for stroke identification. Stroke is also known as brain attack. So every second matters. Brain cells can die and they do not regenerate. So it's important earlier intervention. So identifying the signs and symptoms of stroke can make a difference between life and death. We use the acronym BFAST, where the letter B stands for balance. If one is suddenly losing a balance or losing consciousness, that's a red flag. E stands for eye movement. If there is a sudden change of vision or trouble seeing, that can be a problem. F stands for facial drooping. People commonly recognize this symptom more than anything else. The face drooping, they wake up in the morning, they find that one side of the face is drooping, or the corner of the mouth, the food is dripping from the corner of the mouth. A stands for arm weakness. This is another common sign. When they wake up, or they are unable to lift their arm or leg of one side of the body. S stands for speech difficulty. They try to say something, but the words don't come out, and they are impaired because they are unable to express. So speech difficulty is one. And T is time. Time to call 911. If they have any of these symptoms, this is not the time to get on the car or use the next of the kin to drive to the hospital. This is the time to call 911, use the EMS to arrive at the hospital, because every second counts. Unfortunately, for every 30 seconds in America, we have at least one person suffering from stroke. Every 3 to 4 minutes, one person died due to stroke. And in Arkansas, last year, we had close to 1,800 people died due to stroke.
So, what role does family history play in stroke risk?
So family history plays an important role, particularly as it relates to the heart risk factors. People who have high blood pressure risk factors are certainly inherited. So it's important to know that diabetes, high cholesterol, and anyone who had the father or sibling who had died under the age of 50, the early deaths, that's a red flag or sign that one need to go to the doctor to get their health checked to look at the risk factors for stroke.
And can you discuss any recent advancements in stroke prevention or new treatments that could help at-risk individuals?
Absolutely. So there's a prevention side of it and there is treatment side of it. Now, prevention side, we talked about changing the lifestyles, not smoking, drinking, and not doing any drugs. Maintaining fairly healthy lifestyle, a good diet, reducing the red meat consumption, a number of days consuming red meat in a week can go a long way, along with encouraging more fruits and vegetables in the diet. Lean meat like chicken, poultry is helpful, and engaging in regular physical activity is very important. And physical activity is very underrated for a lot of reasons because it is also a natural stress reliever because physical activity releases endorphins, and it's a feel good hormone. Endorphin is a feel good hormone, so it reduces the stress, calms the helps with the mental health. So it's important to engage in physical activity and maintain a fairly good lifestyle for preventing. And when it comes to treatment, I think we have come a long way in the last 20, 30 years. We have a lot of clot busting medications to prevent. I mentioned to you about 80 to 85% of the stroke are due to the blood clot in the brain vessel. And we have clot busting medications which can be given within certain time. That's the golden hour when they reach to the hospital on time, and they can be administered. And people, I have seen people walk out the very next day from the hospital without nothing happen. So there we have come a long way, and the side effects of these medications are far and few now compared to when it came out in 30 years ago. Also, we are recognizing large vessel disease. The strokes or the clots which are occluding the large vessels, we are recognizing early, and we have endovascular treatment. In other words, similar to the heart cath, they can do brain cath and remove the clots in the big vessels, and the people can recover with minimal or no symptoms at all. So we have come in a long way, but time is essence. We talk about time is brain. This is very important to avail.
It's incredible at how effective those treatments are and make such a difference.
It does. Back in the until about 70, from 50s to 80s, stroke used to be the number second leading cause of death. Arkansas was ranked number one until 2010. Now we are ranked number ninth or 10th. We still have a long way to go, but we have come a long way since we were leading the stroke deaths in the nation.
How often should individuals check in with their healthcare providers regarding stroke prevention? Is there a set of screenings or tests that are the most important?
So, stroke prevention falls under the general heart prevention. As I mentioned, I think every individual need to see their doctor, the primary care doctor, at least once a year to make sure that their blood pressure is normal, their cholesterol is under control, they do not have diabetes. The physician or the healthcare provider can screen them for family history, for any modifiable conditions, and have a blood test done to check all their biomarkers are within the normal limit. We take our cars every 3,000 or 5,000 miles for service. Our body is no different from a car. So, people tend to postpone their doctor's annual visit. Well, I'm feeling fine. I'm okay. But it's an ounce of prevention is worth a pound of cure. So it is important to have these regular annual visits with their physician. And it's even more important as one ages because your risk factors and things accumulate. And so that's where the emphasis on is prevention is very important. And there are things they can do identifying the risk factors, and if they need to be on medications for blood pressure or diabetes or high cholesterol, and that can go a long way in preventing them stroke risk.
Now, are there any misconceptions about stroke prevention that you'd like to tell our audience? Are there some out there?
There are some misconceptions. People call them the mini strokes or TIAs, and oftentimes they are a sentinel event. People who develop these are more at risk of developing a full blown stroke. Ignoring some of these early signs is very important. People have a misconception, oh, well, it's just a momentary thing. No, it's not a momentary thing to lose vision or have a facial droop or whatnot, and they recover. Because sometimes stroke happens in small vessels where they may have a momentary lapse of symptoms and then they regain fully. So they cannot ignore these early warning signs or the misconceptions. And the other common misconception is there's nothing we can do about it. That is not true at all. As I mentioned, we have come a long way in stroke prevention, stroke treatment, and unfortunately, to this day, stroke is the leading cause of not just the death, but also the long-term care admission. People are bedbound in nursing home, and that's an unfortunate thing to survive a stroke and to be bedbound, paralyzed, and it takes a hard toll on the family and the friends.
What advice do you have for people with a family history of stroke or those who have already experienced a minor stroke in preventing a full stroke in the future?
And again, family history is very important. Knowing what you're at risk and talking to your doctor about it and having a plan to take care of the health and have some goals in taking care of the health can go a long way in preventing stroke.
And what are some final thoughts as we close? Some of the public health interventions that the Arkansas Department of Health has been involved in with stroke prevention in the state. There are several.
There are several happening in the state. We do a lot of public education through the signs and symptoms of stroke, like the Be Fast. We have billboards, lanyards, and others to educate the public. We do a lot of professional education. We work with the UAMS, Institute of Digital Health and Innovation, to promote the messages about the stroke to both the public and to the healthcare professionals like the EMS, the doctors, the nurses, and all, to keep them up with the most current stroke prevention and treatment strategies. We also designate hospitals through the health department called the Acute Stroke Ready Hospital designation. We have thus far designated 30 hospitals across the state, primarily rural hospitals who have less resources to go for a Joint Commission designation. The designations help is a testament of their quality of care of stroke treatment they do. We have a stroke registry at the health department. We track all individuals who encounter stroke. We work with the healthcare team in improving the care for stroke across the state. So we have a number of things happening in the state at the professional level and at the public level. But the key message to the public, and this is what I tell my patients, is people have to take their health seriously. And with the American Heart Month, this month, our heart and brain are the key elements of our survival. So prevention is the key. Lead a healthy lifestyle. Check with their doctor, make sure that their family history, their risk factors, and any of their blood pressure, cholesterol, and diabetes are all kept under control. And that will go a long way in preventing this devastating disease called stroke.
Well, Dr. Simon, thank you so much for sharing this important information.
Thank you. Thank you for having me.
And that's it for this episode of AFMC TV. Have a great day, and thank you for watching.